Welcome to New Dentists on the Block, a podcast featuring new dentists sharing their experiences in the world of dentistry, successes, challenges, and life in between, navigating dentistry together one experience at a time. In this episode, we have Dr. Alayna Shoblaske, a general dentist and dental director at La Clinica, a FQHC in Medford, Oregon. She earned her DMD from the Oregon Health and Science University School of Dentistry and completed a GPR at the VA Hospital in Washington, D.C. Elena is the editor of the Oregon Dental Association and a member of the American Dental Association New Dentist Committee. In this episode, we talk about loans and loan repayment programs, organized dentistry, and practicing in a public health setting. Alayna Shoblaske, welcome to New Dentists on the Block. How are you doing today?
I'm really great. How are you?
I'm doing well. Where are you coming to us from?
I am in Medford, Oregon. So that's in Southern Oregon. I am much closer to California than I am to Portland or Washington. We're about 4 hours south of Portland on the interstate.
Oh, cool. Okay. Very cool. Are you an Oregon native?
I count myself as an Oregon native. I was born in Southern California in Redlands, but my mom is from Oregon, and we moved back to be closer to family when I was 5. So this is where I grew up.
Okay, very cool. And where'd you go to dental school?
I went to dental school at Oregon Health and Science University, so OHSU. So keeping it consistent.
Very cool, very cool. And were there any cool things that you all did in your dental school program as part of your curriculum?
We were one of the pilot classes of an interprofessional education curriculum. So we got to take some classes. Well, we didn't do any classes, but we did some seminars kind of with medical and pharmacy students my first and second year of dental school. The other big thing is that we moved into a new building. So we started my first year of dental school in what we call the old dental school. And while they finished building this brand new building that was an integrated building for medical, nursing, PA, dental, pharmacy, all of the health professions students.
Oh, cool.
And then we got to move into that building this summer between my first and second year. So that came with a lot of fancy new equipment and a lot of troubleshooting as well. But it's a really cool building and the most windows that I think I will ever have in any clinical setting.
Oh, yeah, I bet. So, you know, Houston also got a new
Nice.
building. This was after, you know, before we had started. I was there during the summer program, so I was able to kind of see the old building and the new building. And I agree, more windows than I've ever seen ever in my life, which I feel like they were just trying to feed us sunlight to try and keep us happy. But
yes,
I think they needed to do a little bit more than that.
Yeah. In Oregon, you will take all the sunlight you can get before the gray rainy comes. Yeah.
Yeah, I bet, which is so funny because here in El Paso today, it's super gloomy and rainy. And I thought about you this morning. I'm like, how funny. I'm going to speak to somebody who's probably from a rainy area on a very rainy day in El Paso, which is pretty rare.
You could send some of the rain to us. We are dealing with wildfires and smoke
Yes.
right now.
Yeah. I have seen that on the news. Sad stuff. Man, Mother Nature as of late has been pretty scary.
She's got some different plans than I do.
Absolutely. Well, Elena, I'm so excited to welcome you to New Dentists on the Block. For our listeners, Elena and I have crossed paths through our involvement in organized dentistry. Elena, what district do you represent on the New Dentist Council?
11. So that is Oregon, Washington, Montana, Idaho, and Alaska.
Very cool. And it's your first year, or is it your second?
This is my first year.
Cool.
Yeah.
Were you involved in organized dentistry as a dental student?
I was, yes. I was a pretty active member of our ASDA chapter. I think technically my title was community service director or coordinator. So I didn't serve as an officer, but I got to go to 2 annual meetings. So I got to go to Anaheim in 2014 and then Dallas in 2016.
Cool.
Yeah. So we might have crossed paths.
Yeah, absolutely.
Yeah.
Yes, I went. I didn't go to Anaheim. 2014, I started dental school, but I did go to Dallas. I think that was my first annual session, give or take. What year did you graduate?
2017.
Okay, cool.
Yeah. So I got to go to those conferences, went to all of the District 10, where ASDA District 10 district meetings, and kind of that's how in Oregon, there's a really good relationship between the Oregon Dental Association and the dental school. So got to know some of the ODA leaders and staff members through that connection. And then that was a natural transition into ADA leadership
Very
now.
cool. Very cool.
Yeah.
Did you go to Danielle Marciniak's meeting?
She was
Was she?
elected as trustee in
Okay.
Dallas. Yes.
Okay.
So, and then she
Her district.
coordinated.
Yeah.
Yeah. Well, no, I think I'm getting my years mixed up. I think I
Okay.
may
I
have,
could be
but
wrong.
yes,
Okay.
I would be lying if I remembered specifically. I remember Sohive's meeting
Well,
was
everyone remembers
everyone
Sohive's meeting.
remembers Sohive's meeting. That was
Yeah.
in Seattle, my
Yeah.
4th year.
Okay.
Yeah.
Oh, that was your 4th year? Okay, then maybe not.
So I think Danielle was actually elected my
Yes.
4th year as
Okay,
trustee.
yeah.
So,
It would have been the year after.
I missed her meeting by a year.
Yeah, I think everyone still talks about Sohaib's meeting because of all the money he fundraised.
He did
Yeah.
fundraise a lot of money. Yeah, we got to have dinner at the Space Needle, which was
So
really
cool. Like
So
the best story ever, in my opinion.
Yes. Yeah.
Alayna, after dental school, did you do AGD, GPR, any kind of residency program?
I did. I abandoned my Oregon roots. And
Okay.
I moved to Washington, D.C., and I did a GPR at the VA hospital there.
Oh, very cool.
Yeah,
Did you do 1 or 2 year?
1 year.
Very cool. Very cool. And now you're in a public health setting. Were you always in a public health setting, or how did you end up there?
Yeah. I actually, funny story on my GPR. Abby Halpern and I did the same GPR program. So she was the year after me. So I got to hand over the baton to her as I graduated.
Love Abby. And anytime I can talk about Abby, it's a good time.
Oh yeah. We'll shout her out anytime.
Absolutely.
So yes, I have always been interested in public health. I actually took 2 years off between undergrad and dental school. And during those 2 years, I spent some time working for an education nonprofit that worked with low income schools and helped support teachers and students in those schools. And the number of times I have always been interested in dentistry. I kind of knew that I would go back to dental school. And so when I would mention that to teachers, so many of them said, "Oh my gosh, do you have any resources for our students? I have kids that miss school because of their toothaches, or that just don't have a toothbrush at home, or don't have those resources." And it broke my heart so often in that position to be able to say, "No, I don't really know much about the dental landscape right now." And so that really shifted my perspective on how I wanted to practice and what setting I wanted to be in. And so that really drove me to public health and specifically community dentistry. So I applied for the National Health Service Corps scholarship. I did not get the scholarship, but I did get accepted into the Students to Service Loan Repayment Program. So that was a commitment that I made in my 4th year of dental school to work in a federally qualified health center for 3 years in exchange for $120,000 of loan repayment. Pretty good deal. Pretty
Huge.
good gig.
Yeah.
And they allow you to do a GPR. So that's what I did my GPR, got that experience in, and then moved back to Oregon and started working right away at the FQHC where I still work today. So my FQH or my NHSC commitment is long ago completed, but I'm still here because I love our mission. I love the people that I get to work with, and I love the patients that we get to serve.
That's super cool. Yeah. So I'm an NHSC scholar. I got the scholarship in
Nice.
dental school.
Congratulations.
Thanks. I'm almost done with my commitment. And so hopefully another few weeks, actually.
It's fun to get the certificate.
I'm counting down. I think I went over on my days this year. So,
Yeah.
if you get involved with the scholarship or loan repayment programs, you're only allotted X amount of days.
Yeah.
And so I went over my days, and now they're kind of just pushing it out, which is fine. Not a big deal. Thankfully, they're able to work around you. But there are a lot of great programs for any of our listeners out there who are interested in loan repayment. Loans are a huge deal for practicing dentists, especially new dentists who are coming out with these insane amount of debt. But the Students to Service program is great. And I'll ask you a little bit more about that because I don't really know much about that program. But there is also, let's talk about that now. Yeah. How is that program different than the loan repayment program?
Yeah. So I I always talk about the different programs in sort of three tiers.
Yeah.
There's the scholarship, which you make an upfront commitment. You know this well, but
Yeah.
for listeners, you make an upfront commitment usually in the first or second year of dental school, and in exchange, you have most, if not all, of your dental school tuition and fees and expenses paid for. Sometimes there's a little bit of extra on that you do have to take some loans out,
Yes.
but
Yeah.
pretty minimal. Pretty right? Is
I
that
still have
accurate?
loans out, but
Yeah.
perhaps I lived larger than I needed to in dental school. But that
Well,
may just me. And Houston, was a little bit more of an expensive city as well
I
too.
think
So
I think Portland would have been the same way exactly,
yeah. Yeah.
but a significantly lower debt
100%.
burden upon graduation.
Absolutely.
And so exchange with that, for every year of dental school that they pay for, you make a year commitment to work in an FQHC. So that's a more competitive program and requires a commitment at the beginning of your training experience. I went the more middle of the road pathway, and that is that you make a commitment in the fall of your fourth year. So you get a chance to go through your training, you get to maybe rotate in public health, you get to have some mentors and try out some different styles of dentistry and have an idea of how you want to practice. And at that point, you make a 3-year commitment. And like I mentioned, that is for $120,000 of tax-free loan repayment. And so that's a pretty good deal, not quite as much, quote, bang for your buck or bang for your year as the scholarship program, but still pretty great. And you can extend that an additional 2 years for an additional 20,000 each year. So the maximum would be 5 years for 160,000. And then the third level of program is actually a kind of pay as you go option. So once you find yourself working in an FQHC, you love it, and you think it's a place that you want to stay for a while, you can apply for a year-to-year loan repayment option. And I think that varies from about 15 to 25,000 per year, depending on funding and availability and
Of
how
course.
high of a need of an area that you're in. So those are the three different commitment levels. You can commit at the beginning of dental school for the most loan repayment. You can commit at the end of dental school, but before you start working, for a middle amount, or you can commit once you're already working for the lowest amount.
Yeah, I thought I knew about all three really well, but I actually didn't know students to service super well. So that's really good for I get a lot of first year students who ask me, what do I do? I really want to do something like this, but I'm not ready to make that commitment because I don't know if I want to specialize. And this
Exactly.
is this is a great program for that. Obviously, like you mentioned, you may not get the biggest bang for your buck in terms of commitment goes and loan repayment amount, but I think that that's still a great way to alleviate some of the burden
Yeah.
and to figure out what you want to kind of do in life as a dental student. So I think that's huge.
I
Did you
think,
go
oh,
ahead?
I'm a big proponent for working in an FQHC as a supplement to a GPR or an AGD, or as a replacement for, especially if you're in an FQHC where there are other dentists that you're working with. That's one of my favorite things about my clinic. I work with 7 other dentists. And so the amount of mentorship and treatment planning consultation and support, both clinical and moral support, that I get on a daily basis is incredible. And so I think it's a really nice place, depending on how many coworkers you have. It's a really nice place for new grads to
Oh,
land.
absolutely. I couldn't agree more. If you are a student who's graduating or maybe somebody who isn't feeling fulfilled in their practice setting that they're in, public health, community health is the place to be, in my opinion. Obviously, we are biased. We are two people who are in a public health setting.
Yeah,
But I think it's a great way to kind of build your skill. It's a great way to give back to the community, and you just kind of continue to learn and grow. I
yeah,
would say that if you're not really interested in AAGD or GPR, because maybe you want to dive in and start making some money, but maybe you're not ready to dive into a private practice of some kind, this is a really great way to go to kind of build that skill and keep asking questions. I think that if you can find a mentor, for me, my AGD was great because we had a lot of mentors around that we could still kind of toss questions back and forth. And that was a huge year for me, where now I'm kind of alone in this community.
mm,
I'm able to kind of manage it a little bit better.
yeah. I agree completely.
Did you decide to up for a few more years after your commitment ended?
I extended for one more year. So
Okay.
I ended up going for one more extra year of 20,000. So I ended up getting 140,000 total in repayment. And then actually at that point, I had been paying down my loan, the balance. I graduated with about 280,000 in debt, and so the 140 took away about half of it, and I continued to pay down that other half, and got a little bit more aggressive during COVID when there was no interest. And
Yeah.
so, actually, by the time that if there was an opportunity to re up for one other year, I had pretty much paid off my loans.
That's
So, yeah,
awesome. I'm
yeah,
proud of you. That's
thank you.
huge. My
Yeah,
respect, my respect. Yeah,
they are.
I didn't take advantage of that no interest time. I just kinda said, "Thank you, Uncle President Biden, for giving us that, and I'm hoping to stay here for 10 years, and we'll see if you cancel that when when we're all said and done."
I hope not. Yeah,
Yeah.
I went back and forth between
Yeah,
whether I wanted to go for PSLF or wanted to pay them down. And I think that it is highly likely that I will still be here or in another
sure.
FQHC in 5 more years at the 10-year mark. But I kind of wanted to give myself that
Oh,
flexibility.
yeah. That financial freedom that you probably feel with
Exactly.
having that out of the way is huge.
Yeah.
And so PSLF, for our listeners, is also another program that you can look into if you go the public health route. If you stay in a public health setting or an educational setting, you can, or I guess a federal setting as well too. If you stay in for 10 years and make the minimum amount that you need to make based on your salary towards your loans, you get to I guess erase them all in 10 years.
Mhm.
So that's
Exactly.
huge. I mean, that's great. So, if you come out with like $600,000 in loans, that's awesome. You just
It's an
kind of
awesome
got to
program.
stick it out for 10 years and you do a lot of good in the community.
Absolutely. Yeah. And there's a lot of leadership opportunities within community health and public dentistry as well. So I spend one day a week in an administrative dental director position in my clinic. And so I think that's another really neat thing about public health and community dentistry is that it's not necessarily 40 hours a week of hands-on dentistry. You get to mentor and teach and oftentimes work with dental students or support your clinic in other ways. So that 10-year commitment is not necessarily 10 years of commitment to
Right.
40 hours a week. And actually, I was talking to a friend yesterday and they just lowered the requirement for PSLF down to either 30 or 32 hours a week is considered full time.
Oh,
So it used to be
nice.
full time or full time as considered by your employer. So your employer got to define what full time meant, but now they've defined it as I forget if it's either 30 or 32.
Oh, that's
To
huge. I wonder if the NHSC will follow suit. Probably
I
not, but
wonder,
maybe.
maybe,
Yeah. Yeah.
yeah,
Elena, I would love to know kind of your pros and cons, favorite things, least favorite things about working in public health. And if you're okay with it, I'll also share some of mine.
absolutely. I'd love to hear yours.
Yeah.
My favorite things, I've talked about some of my favorite things already. So I really love our mission. We serve about 60% of our patients have Medicaid. In Oregon, Medicaid has been expanded pretty broadly and includes comprehensive dental care for both adults and children, which is really awesome. So we're able to provide comprehensive and coverage and treatment for most of those adults and children. The remainder of our patients are a small section of patients that have private insurance, and then the rest are patients that have no insurance. And so we offer a sliding scale for them. I'm sure very similar to your clinic. And so it's really neat to be able to offer high quality, comprehensive, compassionate, fun, accessible dental care to patients that might not otherwise be able
Hmm.
to afford it. And we also, about a third of our patients speak Spanish as their primary language. And I don't personally speak Spanish, but I have two wonderful dental assistants that act as healthcare interpreters and also assist me procedurally. And all of our receptionists and all of our call center team are bilingual, and so many of our patients say it's wonderful that I can come here and
Yes.
speak my
Hmm.
language and be comfortable and not have to um, strain myself or have a family member act as an interpreter or something
Right.
like that. So that's certainly a pro, being able to meet people where they are and deliver care that works for what they need. Um, I love the people that I get to work with. So, like I mentioned, I work in a big group of dentists. We all share a room, and the amount of fun and collegiality and learning that happens in that room is huge. I love the benefits of working in public health. So I get about 7 to 8 weeks off every year that is paid
Yeah.
time off where I don't have to worry about what's going on in the clinic. I know that my colleagues have got that taken care of. Um, and I get a 403B match. I get health insurance. I get a CE stipend. Our organization also has a really robust learning and development department that offers leadership trainings and communication trainings and lots of both clinical and non-clinical learning opportunities. So we get an additional up to 2 weeks of training every year for free through that program.
Awesome.
So I really feel like I've been able to learn and grow as a person and a dentist here. So those are the big pros.
Yeah.
And I, as far as tough stuff, I think that certainly we're we often say we're a big ship. We are an organization of about 450 people. We have a large number of dentists. We serve 40,000 patients in our dental department every year. And so there are certain times where the way that Elena would do something butts up
Hmm.
against the way that it works best for our clinic to do something.
Right.
I
Yes.
have I have a great degree of clinical autonomy. That is one of our primary values. And so I've never felt pinched in that regard. I've never felt pressured to do or not do treatment. We have amazing materials and really good technology here. So I feel really good about the care that I deliver to my patients. But sometimes when it comes to the workflows and the administrative stuff and all of that, I have to take a step back and let go of some degree of control or influence. So that can be hard, and our patients have tough lives, and so I think that as much as my heart opens and expands and grows with them, it also breaks for them,
100%.
and yeah, and
Yeah.
so we see a lot of substance use disorder. We see
Hmm.
a lot of behavioral health, both diagnosed and undiagnosed concerns, and so I think that there's an extra degree of care that I need to show up with every day, and that can be really rewarding, and it can also be really exhausting. So I think those are the tough things. How about you?
Very well said. I can't follow that. I just think, I mean, you articulated that so well, but I 100% agree with you on the pros there. You know, the autonomy to do what's right for the patient is excellent. I have never felt pressure to do anything against my will. You know, if I don't feel comfortable with a procedure, I'm never forced to do anything that I'm not comfortable with. Materials are great. I kind of have, a free hand in ordering what we'd like to use. So I try and order materials that I like to use. We help patients where we can as well too. The sliding scale is huge, and so for those who aren't familiar with what a sliding scale is at most places you bring in your income and you're given a discount based on that income. So that's great for those who don't have insurance, and they can get a discount still. Oftentimes, and this varies from clinic to clinic, but at our clinic, oftentimes they may come in and, if they're coming in for a full mouth extraction, I can do it all. They may just pay $25, which is kind of huge and kind of crazy. But it's kind of exciting to be able to help the community in that way. So I would agree with all the pros. For me, the cons, being the only one at the clinic that we're at, it can be really tough. So, it's a funnel, and everyone wants to be seen, and everyone wants to be seen yesterday. And so people get really upset with me, and that can be really hard because I'm only one person. And so we have other clinics where patients can go to throughout southern New Mexico, but transportation can be an issue. So everyone kind of wants to come here, and it's hard. And sometimes we get into some tiffs because they're not being seen quick enough. But unfortunately, until I can clone myself, or we can get another dentist, it is just me. We are going to start bringing in some of the students from the El Paso Dental School, hopefully in the next few months or so, for sure
Cool.
within the next year. So I
Yeah.
think that'll for sure help us out with some of the patients that are are on our waiting list. But for me, that's probably one of the biggest cons is that we're just kind of, we see as many as we can in the day, and still there are some patients that aren't happy, but we can't please everyone at the end of the day.
And you've got to take care of yourself as a human too.
That's right.
I remind myself of that when I'm feeling guilty or
Yes.
overwhelmed of that. I give my best care and I show up as my best self when I'm moving at a sustainable pace instead of an unsustainable
Yeah,
pace. Yeah.
absolutely. Yes.
Yeah.
And speaking of guilt, we do get a wonderful amount of time off, but I still feel guilty sometimes taking that time off. And I think that I think that that's a dentistry thing kind of universally because I've heard that sentiment being shared across the board.
Yes. Yeah.
So, Elena, tell me a little bit about just pivoting a little bit about some of your favorite things of being involved in organized dentistry and your role as a new dentist and that involvement, what that looks like for you now.
Absolutely. Well, my path to where I'm at now, so what the last 5 years have looked like, well, 6 years, I was sitting in our resident room in Washington, D.C., and I got a text from the current the current president elect of the Oregon Dental Association, who is now actually our executive director. Dr. Barry Taylor is his name. And in stepping into the president role, he had previously been the editor. So he was having to resign from editor to step into the president role. And so he texted me, he said, "Hey, are you moving back to Oregon?" And I said, "I think so." And I hadn't accepted my job yet. And he said, "If you do you want to be editor?" And I said, "I think so." And fast forward 6 months, I had moved back to Oregon, and there was no one else interested in stepping into the role of editor. So I
I'm
got
still here.
to. Oh, okay, great. I got to run for that position uncontested and was elected as our editor. And in Oregon, the editor serves as a non-voting member of the Board of Trustees and then also always serves as an alternate delegate to the ADA House of
Nice.
Delegates. And so I've been able to participate in the House of Delegates every year since I've moved back to Oregon. So my first was San Francisco, and then COVID, and
Ah,
then Vegas, and then Houston, and then this year Orlando. And that has been such an awesome experience to be able to meet other new dentists and experienced dentists across the board, meet dentists that are practicing in different areas and in different ways. I think it's really helpful for me to get out of the bubble of my daily practice. And it gives me really good perspective for things that I'm extra grateful for, things that I might be striving for, opportunities that I have to learn and grow, and also just to laugh, to be able to talk about how hard it is to prep the distal lingual 131. Just be able to have that camaraderie with my colleagues. The travel is really fun. That is
yeah,
a part of it that I really
for
enjoy.
sure.
And to be able to travel and spend time with other dentists is really huge. I have learned so much about the practice of dentistry through the dental association as well, through our advocacy at both the state and national level. So many times my colleagues will say, "How do you know that thing about the Dental Practice Act or about insurance policy or about reimbursements or scope of practice?" And the answer is always, "Oh, I read it in an ODA email," or "we talked about it at an ODA meeting," or I watched a ADA presentation on that. And so I just feel so much more well informed, and I think that translates to how I can take better care of my patients as well. I that trickles all the way down to my clinical care. About a year ago, Dr. Linda Edgar, who was our trustee and is now the president elect of the ADA, approached me about the opportunity to step into Brooke Fukuoka's position on the new dentist committee. She was finishing her term, and so we needed a replacement. And those are big shoes to fill, but
We love Brooke. Yeah.
we love Brooke. We love Brooke. And she she has mentored me really well through the past year to help that transition. And the new dentist committee is awesome. I know you've gotten to interact with us as
Yes.
our representative on the communications committee, but it's just before I started, everyone said it feels like a family, and I was like, yeah, I mean, sure, it's a committee, but even in just 2 meetings that we've had and a third coming up in Orlando, it really does feel that way. It feels warm and inviting and fun and honest. I think we really are willing to point out what organized dentistry is doing really well and needs to celebrate, and also where we have some areas to grow. So I'm really excited for 3 more years on the committee, get to continue having fun and honest conversation.
So exciting and
Yeah.
and a little bit of jealousy because there are so many great people who are on there now, even including John Vogel, we'll throw him in there.
Yeah, we'll
Yeah.
catch up.
But there are just some excellent leaders there, and I'm excited to see what all the leaders, including yourself, continue to do, throughout their trajectory in their leadership in dentistry. I
Thanks.
would love to know, hot question, what do you tell a new dentist who doesn't think that organized dentistry, the ADA, is important?
I start by inviting them to go to a local meeting. I think that the value of organized dentistry starts really close to home. That I can talk about advocacy wins, and I can talk about the fact that the ODA passed a bill this year that will save dentists up to $7,000 on their credit card fees every year, and things like that. I think that that is valuable and matters. But I think that for me, the largest impact has been the relationships and the mentorship that I have gotten. And I think that that starts small.
Mm.
I think that there's some really neat things that the ADA app is doing to promote mentorship, and I'm excited about that. And I think that you're going to have a more successful mentorship relationship often with someone that is in your community and knows the specifics of where you're practicing, and that you can go and shadow them or grab coffee or become a part of their lives. And so that's my first invitation. If they're local, I say, come with me. We meet
Yeah.
on the second Thursday of every month and have CE and a little bit of social time. If they're another part of District 11 or another part of the country, I help them find their local component and encourage them to attend a CE event or a meeting, and to not just sit in the back corner, but to talk to someone at that meeting and learn a little bit more. Um, I also encourage them to open the emails. I think that
Yeah.
that's it's we're, as you know, we're figuring out how to communicate better
Yes.
with multiple generations, and I think
Yes.
that we will get better at that in the coming months and years. But there really is there's so much information coming at you, and so find the way that you like to engage with the dental association, whether that's following them on Instagram or reading the ADA news or attending the House of Delegates every year. There's different options depending on your favorite communication style, but those are where I tend to start, and then we can have conversations about tangible benefits
Yeah.
and
The
and and,
nitty-gritty.
and discounts and
Yeah, yeah, yeah.
where your dues easily get covered. But I think that if the relationships aren't there, there's not as much sticking power.
Mm. Very well said again. I love it. Yeah,
Thanks.
so for our more seasoned dentists who are listening, a few things that I've heard here, and even those who are not maybe well seasoned and still pretty new, but are involved. One thing that stood out and something that I've heard kind of time and time again is an invitation from somebody to come to a meeting to get involved. I think can go a long way. So I think that we all need to kind of do our part and invite somebody who might be skeptical to come to a meeting and see what all the hubbaloo is.
Yeah,
Yeah, and
exactly.
and kind of see if they're interested in getting involved,
Yeah,
because we truly our generation is the future. We gotta kinda carry this forward, and I truly worry about what the future of the association would look like, but I hope that those, who are listening will feel encouraged to kinda get involved and allow their voice to be heard because their voice is important and can
absolutely.
lead a lot of change.
Yeah, I think a, a word of advice or a recommendation to the more seasoned dentists or anyone more than 10 years out of
Yeah.
practice, right, is that if you see a new dentist that has gotten the bravery or figured out the childcare or arranged their lives to be able to attend a component society, know that that might be your one opportunity to engage with them, to connect with them, and to get them get them to get that stickiness for organized
Exactly.
dentistry.
Yeah.
So go up and say hi. Don't talk to the friend that you see all the time.
Right.
Go sit next to them and get engaged and figure out an action step. Figure out a way that they can plug into the work that you're doing as a local component, because we want to be approached, and
Yes.
approaching someone in a new setting can be really overwhelming. So I think
Absolutely.
that's something that the more established leaders, whether they are new dentists that are established or whether they are past that 10-year mark, they can really take a step by introducing themselves and connecting with new faces that they see at their meetings.
Yes, a friendly hello can go a long way.
Absolutely. Yeah.
Alayna, I have absolutely loved our conversation today.
Same.
I'm so excited to connect with you in Orlando when we see each other during SmileCon. But any last thoughts, advice, anything that you'd like to share with our listeners before we close out today?
I think we covered it all. I don't do any fun TikToks and dance movies like you, but I do have an Instagram. It's just Alayna the dentist, and I try and post about what the ADA is doing, what the Oregon Dental Association is doing, and also what my life is like in an FQHC. So if you have any interest in that, you can find me over there. And reach out if you are in District 11. I'd love to help you find your local component. I would love to share some opportunities that there are to get involved if that feels scary and you want someone to help you with that.
Yes, please reach out to us. Either one of us, please use us as a resource, either for organized dentistry or for the public health route. We would love to help you all find your path in dentistry, both in and out of the actual clinical setting.
Absolutely.
So, Alayna, thank you so much for your time today. I really appreciate it. And for everyone listening, thanks for tuning in. Thanks for tuning in to this episode of New Dentists on the Block. If you would like to connect with Dr. Elena, you can find her on Instagram at Elena the Dentist. Learn more about the ADA New Dentist Committee by following the link in our show notes. If you'd like to connect with New Dentists on the Block, you can find us on Instagram at New Dentists on the Block. And you can connect with me on Instagram at tsmaestas.dds. Be sure to tune in to future episodes of New Dentists on the Block. And as always, we would love if you would leave a review of this podcast, and make sure you subscribe to the podcast on YouTube and on all major podcast platforms. We'll catch you next time.